Dr. Davis, let's talk about Botox. And there's one thing I heard about Botox, and tell me whether that's possible and whether you do it. People who sweat in their armpits and maybe in other areas in the back, even on the feet, and they're using Botox to stop sweating. Is that true?
Oh, yes. We do Botox. We use Botox for quite a few different areas. Not only do we use Botox for the wrinkles of the face, we use it to control headaches. We use it to control sweating in the armpits, the palms, the feet. Not so often the back, but you could. But the sweat glands in the back are hard to get to. It's most commonly the armpits, the palms, or the bottom of the feet, and less commonly in the feet than the palms or the armpits. Right. Lots for migraine headache control as well, or attention headache control. We find that people that squint a lot, kind of like this, if they relax their forehead where they can't squint, that their attention headaches are relieved a lot. People who tend to tighten the back of their neck a lot tend to get headaches, and we find Botox is useful for that as well. So not only is it used
when they do
in the back of the neck.
Oh, I
in the
see.
back of the neck.
Okay.
In the back of the neck. Right. In the back of the neck, sometimes in the shoulder area, back down in this area. It depends on the person where they tend to tighten and where they tend to carry their stress.
Wow.
But it's used for that too, and it works quite well.
Looks to me like it's used more for, it has more applications in terms of headaches and shoulder back pain and sweating. I mean, those are big things. It seems to be that's a bigger part of it than looking good.
Well, it's a big part of it. I wouldn't say that it's a bigger part. I mean, a lot of people want to look good, but
sure.
A lot of people want to feel good too. As we said in our clinic, one of our mottos is, and its alpha part is, this is my medical clinic. We want you to look and feel your best.
Right.
That's what we're here for, is to help all of our patients look and feel their best.
Well, I don't know because I surely didn't, but that doesn't mean, there's lots of things I don't know, but I'm not so sure that all people know that sweating, under the armpit, Botox can help, because if a person has it, and I know a few people who do have it, and they're not even necessarily heavy overweight, they just, God only knows why, and they can get rid of it, and it's an uncomfortable thing, because it looks ugly, usually it starts smelling throughout the day, but even if it doesn't, it just, it doesn't look good when you work in an office and you can't,
Right. It can be very embarrassing.
It can be very embarrassing. So that looks like a great thing to do. Now, but let me ask you one more thing about the people who want to look better and get the Botox thing. What about that stigma of then you have a frozen face and you look unnatural? Is that old technology which made it happen and doesn't happen anymore? Is that people who overdo it? Is that doctors who don't know what they're doing? Or is that an occurrence which, yes, it's there, you're going to start having a stiff frozen face? Shed some light on that. Tell me about it.
No, you're not. You should not have a stiff frozen face. If you have a stiff frozen face, it's either because you choose a stiff frozen face or because someone injected too much.
I see. Because I saw some movies there, but oops. Hello?
Yeah, my light went. Yeah, just a minute. Sorry. My lights are on, if there's no motion for a while, it's an automatic sensor and they turn off. Sorry.
All right.
I said very still. Sorry. You'll have to edit that.
Anyway, so basically you're saying that, the people who start drinking their coffee and it goes all over the place because they can't feel it, something went wrong in the doing. It shouldn't happen.
Right. You have to be very careful about injecting Botox around the mouth. That's it's very difficult to do. You have to really know what you're doing to put Botox around the mouth.
Mm-hmm. Okay. So, what about Botox in terms of like, we're talking, and even for the armpits or so, it couldn't possibly last forever. Is that something you can do over and over again, or is there a danger in that also, that then after too often it just whatever?
No, as a matter of fact, Botox for sweating lasts quite a while. It lasts usually 6 to 9 months usually for sweating.
Well, that's
it lasts a long time. Botox for cosmetics is interesting. When you first start doing it, it wears off more quickly, but your muscles get muscle memory. So the more often you have it, the longer it'll last. So you need it less and less often to get the same result. So it's counterintuitive actually, but you do get muscle memory for the relaxation of it. So you can have it over and over and over again, and it will not hurt you.
Interesting.
And it's safe.
So it is safe, and all that being stiff and frozen looking, it's just an over-exaggeration, and if done correctly, and if not overdone, it just simply isn't going to happen.
No, you look very natural. It's a very, very natural look.
Wonderful. Well, I like the fact of, even though personally at this moment I won't need it for that, for, the sweating part and the headache part, because there's lots of people out there with headaches. So anybody having a headache, migraine, and simply not quite, having tried other things, going to an MD, didn't quite work, or, taking already truckloads of Tylenol, blah, 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 would it be a wise thing for that person to try Botox? I mean, it might not work maybe.
Sure.
It might work.
Sure. The people that we've used it on have all had success with it.
Interesting. I should tell my sister in Austria maybe to try it, because she has migraine all her life already.
Yes.
But she needs to go to a right person who is trained in it, who knows how to use it that way.
Right. Exactly.
Okay.
Right.
Good. Well, you always come up with new stuff, Dr. Davis. It's wonderful. Bye-bye.
Thank you. Bye.